Good afternoon, ladies and gentlemen. Welcome to this session of the Enhancing Clinical Practice and Outcome stream of the SNOMED CT Expo 2023. My name is Michael Jones and I'm a MAP specialist at SNOMED International, and I will be acting as the moderator for today's session. Just to remind you all that the questions will be answered at the conclusion of the presentation. For those attendees who are joining us online, please use the Q&A button to type your questions to the presenter, and anyone attending on site, please just make your way up to the microphone provided in the room to ask a question. It is now my pleasure to introduce Dr. Fabio Cerqueira Lario from Hospital Syria, who will be presenting on clinical recommendation, allergies and adverse reactions from SNOMED CT sub-ontologies and natural language processing. Fabio, please go ahead.
Thank you, Michael. Well, it's a really honored to be here at SNOMED CT. It's my first Expo, at least in-person Expo. I've done the online experience before, but we are very excited and pleased to be here. And we thanks SNOMED CT team that helped us a lot during this process and during this paper as well. Mainly Susie that was a key person to help us to be here today. Well, I'm a cardiologist as background, and I've been practicing in the last 25 years. And during the pandemic, I have to answer the call to change career and make a shift through health informatics and data science. So it was very nice to be. It is very nice to be here today and share with you our experience with SNOMED CT and in this field of science. Well, I'm here talking. We will present the clinical recommendation of allergies and adverse reactions from SNOMED CT sub-ontologies and natural language processing. What we've been doing is a creation of sub-ontologies using SNOMED CT reference sets and domain-specific rules based on definition by specialists for creating alerts and clinical recommendations. And I'm speaking here on behalf of this beautiful team that we had the pleasure to gather during these last few years. That is dedicated in this research. It's a multidisciplinary team that works with us at the hospital. We are Hospital Sírio-Libanês in Brazil. We are one of the 6 hospitals considered of excellence hospitals there. It's a philanthropic, not-for-profit institution, and that in exchange of not paying taxes, should submit projects to our NHS there in Brazil to advance the public health system. So we have the opportunity to improve and enhance this work, collaborating with this project there in our country, led by Professor Beatriz Leão, that's here with us, and without her mentorship, not enough. This would be possible as well. So that said, we will present here an approach based on the construction of these sub-ontologies from SNOMED CT, and also domain-specific roles based on definitions by specialists for creating alerts and clinical recommendations. Well, we've seen there that aligned with the literature at our institution, almost 35% of patients had at least one allergy documented in their electronic health records. And through the time, the registries are always accumulating. So people are granted new registries. So we learned that we also need some form of to pre-label or to evaluate this label of allergies of our patients. Also, 4% have 3 or more documented allergies. And we also know that almost 13% of these events could be fatal for the patients if they are re-exposed to the allergen or the substance that caused it. So we have to define our clinical problem better, because work with all the allergy sets there in this short period of time would not be possible. So the problem that we have there is we should choose to work with the anaphylaxis problem. That is a smallest list of substance and concepts that we could improve further. And also the objective was to identify a use case that we can improve fast using SNOMED CT as a reference. So then in our institution, we sometimes have life-threatening preventable events, and also in the international literature, when patients are re-exposed to substance that they know that they are allergic. Also, that happens because the data input is not a priority for the healthcare team. You know, they have competing priorities when working and helping people with such a serious reaction as an anaphylaxis. So sometimes this is not registered in a structured way in our EMR, and so we could not prevent another reaction if this patient it's come to the hospital another way. Also, we have a lot of incomplete records that are missing the severity informations of the allergies. So that also makes it difficult to identify these patients. And in our institution, this is still unpublished data, but we're hoping to publish it soon. We have up to 50% of data in unstructured health records. So it's very difficult to identify these patients. And we know that our EMR should be improved as a barrier to these adverse events, so that the way the vendor put the things there not facilitate sorry, I'm here. Sorry, not facilitate. Oh, no, it's working. Here's the team. Not facilitate us to put or to prevent this kind of thing to happen. So we've been working, as I told, with the IPS, and that helped us a lot to improve faster, collaborating with the allergy sessions in the APS that were working and putting all these things together. So here is our approach in blue, where we are today, and in yellow, where we are, our objective, our final objective. So our approach begins with the identification of the clinical terms related to the anaphylaxis domain. These terms were validated by the experts of the team. A list of the terms was created and sent to SNOMED CT sub-ontology extraction tool. In parallel, axioms were created in natural language based on the literature criteria by experts, and then written in the ontology by the ontologists and terminologists. From the creation of these axioms in the sub-ontology, the instantiation of the concepts was carried out considering some manual clinical notes. This instantiation occurred via code using OWL, ready to, and then the next steps, we're working to have automatic instantiations of the ontology through an application that can help healthcare professionals to obtain a diagnostic recommendation or suspicions for anaphylaxis reaction. Here is some of our results. We made a reference set considering three main contests. First, terms directly related to anaphylaxis disorder, and is known as SCT, its descendants and children of descendants. Second, terms related to the signs and symptoms of anaphylaxis validated by this group of specialists. And then we also use the CBARA classification there in Brazil. That is a classification of allergies with more than 150 terms to enrich the terminology server as well. In further terms found in the clinical note, if they were not in this half set, they will be added to the application ontology as well. So till now, we mapped terms directly related to anaphylaxis for more than 70 terms. The CBARA 150 terms were also mapped, and terms related to signs and symptoms of anaphylaxis that were more than 400 terms. With this said, here is an example of the screen of the part of the sub-ontology generated by the application. And that ref set of 674 classes or concepts, we have over 4,000 different axioms or associations between concepts, properties, declarations, and rules in the anaphylaxis domain. And the figure represents that related, the part of the related concepts in this sub-ontology. Here is what we based all this role it's known by this community, that this anaphylaxis axioms of SNOMED CT. With the in Brazil, we seldom have this final contest, the immunity-mediated test. So the application will be more about suspicion of anaphylaxis and a recommendation to the clinician to confirm that diagnostic and put it in a structural way in our EMR. So it's worth noting that the SNOMED CT axiom cannot be activated because of the lack of this information in our EMR today. Here is an example of criteria utilized. We used two main criteria for the building the rules. The first of criteria, literature classifies the acute reaction and considers the involvement of the different systems. And the second criteria sets that the acute onset and hypotension and bronchospasm are different involvements. These two criteria have been broken down, and we are writing them in ECR rules right now to create a pre-diagnostic recommendation. So this is where we are today, our current approach. We used an open clinical notes that is available to us there in Brazil in Portuguese to extract the concepts using large language models and also Azure to capture the entities. And then the entities were instantiated in the ontology classes through extraction of sub-ontology from the specifier ref set using a specific tool developed by the team, and also using Sparkle and ODODO2 Red2 to instantiate this ontology. And then we can use the axioms reasoning through the sub-ontology of SNOMED CT, and that was done using the Protégé tool that was used to execute this reasoning. So through this axiom, we have been able to build an anaphylaxis suspicion alert, and in the next phase, we will deliver that alert to the clinicians for clinical condition. Here, this interface is an example that was defined based on the command line interface, SNOMED sub-ontology extraction, to enable doctors and ontologists to extract sub-ontologies from the created ref sets. So this facilitated the execution of the tests in different versions of the ontologies during this project. Here is an example of the screen. So we have the file, we can extract the sub-ontology and put in the output directory. So ending, the main results of this work is we've been able to build our anaphylaxis ref set, and also a tool to generate the sub-ontologies of this ref set. We also work on new axioms from medical literature and being able to validate through expert opinion these axioms. The main lessons learned through all this process that we see that standardizing all the data will facilitate interoperability further when you can fully use this instrument. Also, it helps us to standardize and validate the diagnosis and suspicions. And the team also in the months of this year, we learned a lot using SNOMED CT associations, because it's for us that all the team was initiating this process. We considered it's a very complex process, and now the team is more, I would say, habituated and now understand better how to use that associations, the power of SNOMED to build the reasoning. In our next step, we're currently working to validate all this concept in these open clinical notes there in Brazil, and then we will build the instrument to put the anaphylaxis suspicion in our EMR through a FHIR and SNOMED CT framework, and we hope and we are confident that we can implement this tool both in our EMR and in our patient portal there at the hospital, with the objective to reduce this kind of event, because even if we have in the past lots of different actions to try to solve this repeating event at the hospital, we keep seeing it. So we must build or use technology in a way that we can really help our clinicians and our staff to protect and to improve the security or the safety of our patients. Well, this is what I had to present to you. It was a pleasure to be here, and I will be pleased to answer questions, and the questions that I couldn't answer, I'll be pleased to connect you guys with our technical team that could help us to address the questions. Thank you.
Okay. Thank you, Fabio. So if there was anyone in the room who would like to ask a question, please feel free to go and stand at the microphone, or I can pass the microphone over if that's easier for you. So that our online attendees can obviously capture the question. And for those attending online, you can enter your questions into the Q&A box at the bottom of the Zoom screen.
Thank you very much. It's a brilliant presentation. I think that's have a lot of applications, because in different specialties, your approach really can be applied in different areas. My question is first about your sub-ontology extraction. Which particular tool? I just double check, because in SNOMED International, we worked with the University of Manchester, developed that open source sub-ontology extraction software. I don't know if you use that software or you have your own software developed.
Yeah, well, I could address that to the team, but the team has built an instrument to instantiate the sub-ontologies, yeah. And we are working also with SNOMED CT to compare and to see how it works, but we're just there yet, you know, they don't have the results. Yeah.
Okay. Thank you very much. Yeah. Thank you.
But to be more specific, just feel free to email us and I can connect with the team. Yeah.
Is there anyone else in the room that would like to ask a question? Over here. I have a question, if I may. That's okay. So, how was the actual SNOMED CT ref cell built? This would be my first question. And then, why use ontology for this particular area of work?
Okay, I'll try to answer that. That's my medical background. We're working on a terminology server, because we don't have that in Portuguese in Brazil. And the sub-ontology was created mapping the concepts to the SNOMED's concepts, you know, because you want to finally that we can be able to use all the power of SNOMED concepts to do the reasoning, you know. We had another presentation, we believe that we can build like an engine that can extract these concepts and help us to link that concepts to SNOMED concepts, so we can make it, I would say that, you know, to scale that to other services, other hospitals there in Brazil, or even make it easier to implement in this way. So the ontologies were created by our specialists using this mapping and a tool that the team is working. It's, I would say, working with different tools to do that. Yeah. But I'm really, you feel free to email us, because it's very technical, and I have a very clinical background, you know.
Thank you for that. So we don't have any questions that have come in online. So if there aren't any other questions in the room, then I would like to draw. Oh, okay. Sorry, we have one more.
Might be a question for offline, so feel free to tell me to just come back later. But I'm curious if so the sub-ontologies you're producing, there's a lot of work on modularization tools in the LAPI from Manchester, for example. And as Jong mentioned, the tool at SNOMED. Have you looked into the properties of your sub-ontologies compared to, say, like a star module of SNOMED with the same ref set? Or is that for upcoming?
Yeah, that's upcoming.
Okay.
We'll look like, yeah.
Great.
Thank you for the question. Yeah, makes a lot of sense. Yeah.
Okay, then with that, we will conclude this session. Thank you once again, Fabio, for your very interesting presentation.